Assess cavity preparation for anterior tooth. 1. Rationale of assess cavity. Provide straight line access, conservation of tooth structure, and unroofing the pulp chamber. 2. Armamentarium.
Don't forget that you should isolate every tooth before endodontic therapy. Different burrs can be used during access opening. Round burrs, either carbide or diamond, Endo Z, and Gates-Glidden drills are very helpful and commonly used during this phase of the endodontic.
Key files. Step 1. Removal of caries and permanent restoration.
This is essential to mechanically eliminate as many microorganisms as possible from the interior of the tooth, for assessment of tooth restorability and to provide sound tooth structure so that an adequate provisional restoration can be placed. Step 2. Initial external outline form. For maxillary and mandibular incisor, the access cavity have triangular outline, while for maxillary canine is ovoid shape. Step 3. Removal of the pulp floor.
The first thing that you would do before access preparation is to swab the tooth in the area with tincture of mercressin. Here working on the model, we'll skip that step. The second step is once again to visualize the pulp, its position, its shape. Really get a picture in your mind of where you're going with the tooth. And don't start until you're pretty sure you have it. If it'll help you, you can outline on the tooth with a pencil what you expect your tentative outline form to be. The third step is to establish your tentative outline form in the enamel with a high-speed 1057 burr. You hold your high speed at right angles to the surface of the tooth, so the burr forms a right angle with the surface of the tooth. You penetrate through the enamel to the dentin. You extend this laterally until you've roughed out your tentative outline form in enamel. You hold the burr at right angles to the tooth surface so that it won't skip across the enamel and gouge the tooth, and also so that you can form nice right angle margins if you're going to restore this tooth in acrylic. Once you've reached the dentin, the level of the dentin, you can put your high speed aside because you're done with it. The next step is to connect the outline form that you establish with your high speed with the pulp chamber. Now in this step, you use the number 4 low-speed round burr in your low-speed handpiece. You change the angulation of the handpiece so it will cut down the long axis of the tooth. You know the pulp is going to be in the center of the tooth, so you want to cut right down the long axis of the tooth. And in one straight shot, you connect the original outline form with the pulp chamber. You'll know when you get to the pulp chamber, when you feel the burr kind of drop into the pulp chamber, as there's a reduction of cutting pressure on the burr. Now, if you have the proper angulation in this step, it's almost impossible to miss the pulp chamber. You have to keep the head of the handpiece tucked over the incisal edge of the tooth. Now, there are two ways where people get in trouble in this step. One is to start off in the wrong angulation. They keep it in the same angle that they kept the high speed, and they continue right out, miss the pulp, and go right out the front of the tooth. Now, patients don't like you drilling holes in their teeth while you're looking for the pulp, so make sure and check your angulation so that you're in the proper long axis of the tooth and go right on down. The second way you might get into trouble is if you're in the proper angulation and you get part of the way to the pulp and you get kind of nervous and you feel like you've gone too far, so there's a tendency to start to drill around in this area looking for the pulp. Now, you never want to do this, because if you find the pulp, it'll just be by accident. The only way to find the pulp is to really know where it is and go directly to it. Once again, you'll feel the burr fall into the pulp chamber as there's a sudden reduction to the drilling pressure as you enter the pulp. Now, if you really get lost and you feel like you just don't know where the pulp is or what the angulation of the tooth is, you may want to stop and take a radiograph. Now here you can see that someone has gone the wrong direction twice. He didn't realize the angulation, the long axis of the tooth, so he stopped, took a radiograph, then he can reorient his burr.
Step 4. Identification of all canals. Identify all the canals using an endodontic explorer to locate the canal orifices, followed by a small-sized key file to explore the canals following the unroofing of the pulp chamber. Step 5. Removal of lingual shoulder, cervical bulge, and coronal flaring.
And go directly on down. Once you feel a burr, drop into the pulp chamber, stop the handpiece from running. Now that the burr is in the pulp chamber, we want to unroof the pulp chamber working from the inside out. With the burr not running, we want you to feel around the anatomy of the pulp chamber a bit, just so you'll make sure that you know where the roof is and unroof that as opposed to gouging the walls. So you can stick the burr a little bit on farther down, feel where the walls are. Run the head of the burr against the walls with the handpiece off. As you withdraw the burr from the channel that you made, you'll hit a bump as you hit the roof of the pulp chamber. When you feel that bump, you know that that's where the pulp chamber starts. You can do that in the other direction too. That's where the roof of the pulp chamber starts. When you feel that bump, you want to start the handpiece running again, apply pressure to that area of the roof, and bring the burr right on out, removing the roof of the pulp chamber, working from the inside out. Now let's return to the model. Okay, returning the burr into the pulp chamber, feeling for the wall, keeping away from the wall, recognizing where the roof of the pulp chamber starts, you slowly remove the pulp chamber, working from the inside out. Now you won't be able to remove it in one pass, so you'll have to reinsert the burr. Feel again for the walls, keeping away from the wall of the pulp chamber, locating, in this case, the lingual roof of the pulp chamber, and once again unroofing, working from the inside out. Now you keep on doing this in and out, feeling for the roof, making sure that you keep away from the walls so you don't gouge the tooth, until you feel the burr pass from the pulp chamber to the surface without any kind of bump or click. When you feel this, you turn the handpiece off, you get your endodontic explorer, and feel the walls of your cavity preparation. Make sure that you've completely removed the roof of the pulp chamber and that you haven't gouged the walls. We've completely removed the roof. Then with the surgical length flame-shaped burr, we enter into the pulp chamber and smooth the walls and flare the walls of our access preparation. This is a very inefficient cutting instrument, so you have lots of control to completely smooth and flare the walls. Once this is done, your preparation should be complete. Is to check and make sure that the roof has been completely removed, that you have access, that you've not gouged the tooth, and that you fulfill all of the requirements for a properly designed access preparation. Now let me show you the steps of this procedure on an actual tooth.
Step 6. Straight line access determination. Determine the straight line access. Evaluate by inserting into the canal the largest file that fits passively to the apical foramen or the point of the first canal curvature. The internal length can be determined by measuring a diagnostic pretreatment periapical radiograph. Step 7. Visual inspection of the cavity access. Visually inspect and evaluate the access cavity. Check the axial wall at the junction for presence of an orifice that might indicate an additional canal. The orifice and corner canal must be evaluated for any bifurcation. Thank you.